Refinements and mid-course adjustments. Outline will include definition of refinements and MCAs and how they differ, the possibility of refinements and the most common reasons to request refinements. Then we'll discuss the possible causes for loss of tracking and how to reduce the need or number of refinements. And finally, we'll walk through the process of requesting refinements or MCAs on EON Access. Refinements are defined as an extra set of aligners that are needed after the first version of treatment is finished. Those are required when one or more teeth have not reached their final anticipated position, and further alignment and leveling are still needed. Mid-course adjustments are extra set of aligners that are needed when the aligners stop fitting during the course of first treatment. So basically, the difference between refinements and MCAs is the timing. Refinements are requested after being done with the first treatment to ensure the final results are reached, and will usually be of a shorter duration of treatment in comparison to version 1. While MCAs are requested mid-treatment when aligners, for some reason, stop fitting. In both cases, a new scan or impression is needed, and a new treatment plan is created. Research has shown that refinement aligners are very commonly needed after the first set of aligners are done. So let us think of refinements as a second phase of treatment. This is usually intended to finalize the alignment and leveling and reach the final anticipated results that were not 100% achieved after version 1. This is important to understand and explain to your patients from the beginning of any aligners treatment. Because of the high percentage of refinements needed, EON offers free refinement steps in all packages. 6 steps of refinement are offered with both light single arch and light packages, whereas an unlimited number of refinement steps are offered with an unlimited package. Let's start discussing some of the most common causes to request refinements by the end of the treatment. First are residual spaces. This is common and possibly occurs when aligners were not given enough time to fully retract teeth and close the spaces, or due to performing excess or incorrect IPR. This is usually addressed in refinements by retraction of teeth and possibly adding overcorrection steps to ensure full closure of spaces. Second is posterior open bite. This usually occurs due to the normal intrusive forces of aligners on posterior teeth, especially in long treatment durations. This is also addressed in refinements either by actively extruding posterior teeth with the help of auxiliaries if needed, or by cutting the last few aligners distal to first molars to allow the bite to settle. Third point, which is the most common, is not getting to the final anticipated alignment or leveling. In other words, when the final result on the 3D simulation was not achieved. Last is black triangles. These are commonly seen by the end of the treatment, either due to tipping movements of teeth happening instead of bodily movements, or in cases of triangular-shaped teeth or short papilla. Those are usually addressed in refinement using IPR to flatten the contact areas and approximate or retract the teeth. Next, we will jump to discuss the possible causes for loss of tracking. We can roughly classify those to uncontrollable and controllable causes. First are the factors that cannot be controlled, which include differences of biological response of individuals, challenging movements, and advanced cases. Others are controllable or avoidable causes, which include patients' compliance and any inaccurate procedures done, such as inaccurate records, IPR, or attachment placement. First factor is the biological response of individuals. Remember that aligners work by applying push forces. These forces will cause areas of compression and thus osteoclastic activity and bone resorption. On the other hand, areas of tension will enhance osteoblastic activity and bone deposition. As a result of this biological process of bone remodeling, teeth movement will happen. Because the response of individuals to this process is variable and cannot always be accurately predicted, some teeth movements may not track as expected, and thus refinements will be needed. Next is challenging movements. It has been shown that some movements are more difficult to achieve than others, some of which are rotations, extrusions, intrusion, torque, and bodily movement. For example, recent research has shown that maxillary canines demonstrated the lowest percentage of accuracy for rotational tooth movement. Also, upper laterals are prone to loss of tracking as they are surrounded by large teeth, making it difficult for aligners to grip. So, when planning any of these movements, some discrepancies might be noticed by the end of treatment between planned movements and actually achieved ones. Minor differences are acceptable and can be simply addressed with refinement plans. More major discrepancies will lead to malfitting of the aligners and eventually the need for MCAs. Of course, the more complex a case generally is, with longer treatment plans and combination of difficult movements, the chances of needing refinements will be higher. Now, moving on to one of the most important factors that will affect tracking is patients' compliance with aligners treatment. Remember that aligners will only work as intended if worn for the expected duration of 22 hours per day for 1 to 2 week cycle. Any lack of compliance with aligners wear, or with attending to appointments of IPR, attachments, or follow-up as scheduled, will possibly result in loss of tracking. So, how can we tell if the patient is not compliant with the treatment? If a patient keeps missing his follow-up appointments or shows up to the clinic not wearing his aligners, also having difficulty in putting the aligners in and taking them out, then this means they are not used to doing this regularly. And last, very clean aligners are also not a good sign. Now moving on to other causes. Inaccurate records. Records need to be accurate, reproducing the anatomy of teeth with clear gingival margins and capturing the last tooth in the arch, including third molars if present. Failure to do so might result in poor fitting of the aligners. Also, failure to capture third molars will possibly result in their over-eruption, as those will not be covered by the aligners. This will result in occlusal discrepancies by the end of treatment, which is another reason to request refinements or MCAs. Next, inaccurate IPR. IPR amount and location is set very precisely for each case to provide space for different movements and alignment. For example, a rotational movement requires the tooth to have enough space around it to ensure the movement will happen. In cases where IPR was planned for a rotating tooth but was not performed accurately either in amount or even if done incorrectly, leading to ledges, for example as shown in the photo, then we would expect the movement to not track well, and the final anticipated result will not be achieved. Furthermore, the lack of space might result in unwanted movements as a side effect, such as intrusion. This, again, can be addressed in refinements. Another factor that will affect tracking of cases is attachment placement. Attachments are essential to facilitate different movements. Proper aligner grip around the attachments is necessary for forces to be applied in the correct direction, and thus achieve the planned movements. In cases where defective or improperly shaped attachments are placed due to poor technique, aligner fitting and thus movements and case tracking will be affected. Now, after understanding the different factors that might lead to loss of tracking, we will mention some tips to help in reducing the need and/or number of refinements. Starting off with having accurate records. Make sure all teeth are captured with clear gingival margins, as we previously mentioned, to ensure proper aligner fitting. It's also important to properly select the case according to your level of experience, while keeping in mind the predictability of different movements with aligners, and also the patient's enthusiasm and capability of complying with the treatment. Always make sure to set clear and detailed instructions for the desired treatment objectives and patient's needs from the beginning to avoid any change in treatment goals mid-treatment. In addition, thorough examination of the patient's dental and periodontal condition is essential. Always try to start the treatment with a healthy dentition and periodontal status to avoid emergency dental work during the course of treatment, as this will result in non-fitting aligners and the need for MCAs. Another important point, as discussed previously, is achieving accurate IPR and attachment placement by using the proper techniques and instruments for the procedures. Of course, it cannot be stressed enough the importance of monitoring and following up with your patients to ensure compliance and provide the necessary adjustments whenever needed during the course of treatment. Let's move on to some tips and tricks to follow after your patients are done with their first treatment. First is patient management. Always make sure to set your patients' expectations from the beginning. Inform them about the possibility of refinements before the start of treatment, and that the number and duration of those will depend on case complexity and their compliance. Also, when a patient is done with their first set of aligners and a new scan or impression is taken for a new refinement treatment setup, make sure that the patient keeps wearing their last set of aligners during this period until receiving their refinement aligners. This is to avoid any teeth movement or relapse, as this can happen very quickly and will eventually affect the fitting of the new aligners. Now moving on to some tips to follow when requesting the adjustment, regardless if it was a refinement or an MCA. Start with evaluating the progress for your patient and comparing it to the treatment setup, and inquire about the possible cause for loss of tracking. Is it a compliance issue or due to difficult movements, for example? Knowing the cause will help you address it better in the refinement stage. If the loss of tracking and poor fitting of the aligner was noticed during the last few steps of treatment, a refinement is requested. While if this happens mid-treatment, a mid-course adjustment is requested. Then decide on what needs to be improved in refinements, and make sure to write detailed instructions for these. For example, don't just say, "Patient needs refinements," but try to describe with more details, like saying, "Finish alignment of lower anteriors and more extrusion of the upper right lateral incisor, and close residual space between upper left 2 and 3. This is essential to guide the treatment planning team to address any issues more precisely. The third point is to provide new clinical intraoral photos for the patient's teeth and bite at this stage. This, again, will be of great value for the treatment planning team to evaluate the clinical appearance of teeth, the bite, and address any needed adjustments that might not be as obvious on the scan. For example, black triangles and residual spaces will be more vivid in photos. Which takes us to our next point. Finishing up with some residual spaces is one of the most common reasons for requesting refinements, as mentioned earlier. Sometimes those are not accurately shown on scans, so it is advised to measure the amount of spaces and specify their exact locations, so treatment setups can accurately address those. Next is adding attachments. Keep in mind that it is always possible to add or replace attachments during refinements, especially for a less responsive tooth that is not tracking well. So, try to be precise and request attachments whenever deemed necessary to ensure the movement of a specific tooth. This is explicitly helpful when the number of aligners is limited. And finally, ask for overcorrection steps if you are expecting that a certain tooth or teeth will lag behind to increase the predictability of getting to the final desired result. Now, lastly, after you have requested and received the refinement treatment setup, it's time to make sure all the details were followed and achieved. So here is your checklist. Start with checking if the goals or requested adjustments were achieved and that the final results are satisfactory. Check the number of steps. Check the movements and protocol. Check IPR and make sure it does not exceed the maximum amount, and keep in mind any IPR done in previous treatments. Check if any new attachments were placed or any changes on them were applied. Now moving on to the practical part of this module, how to request for adjustments on Eon Access. Open up the case details from your Eon Access and choose the Adjust tab. This will take you to the next page. Here, you will choose the current upper and lower steps that the patient has reached and the last tracking steps for upper and lower. This will determine whether it will be a refinement or MCA. The box below is where you can specify the reason for submitting adjustments, and as mentioned earlier, always make sure to have specific and detailed instructions in terms of alignment, residual spaces, and the desired treatment goals in general to make sure the treatment planning team will address those. And finally, in this box down here, you can write any further specific instructions. Here, you will choose the appropriate method to send your scans, either directly or through a third-party integration system, or arrange a pickup for an impression. The final step is to submit new photos. This step is optional but recommended, as it will help the treatment planning team have a better visualization for the details of the patient's teeth, such as black triangles, spaces, teeth alignment, and any bite issues. Thank you for watching.